Hi, I'm Tiffany Silman, the Director of Infection Prevention and Control at Chesapeake Regional Healthcare. After the pandemic and over a year of adaptive schooling, parents, students, and teachers may have questions and concerns about return to school. Even in a normal school year, it's important to know how to prevent the spread of illness in classrooms and at home. The first step to preventing the spread of illness is actually knowing whether a child is well enough to go to school. Determining this can sometimes be tough for any parent. You should never send a child to school who has a fever of 100.4 or greater, is nauseated or vomiting, or has diarrhea. Those are pretty clear-cut signs of illness. Other signs I recommend parents look for is if their kids have little to no appetite, are clingy or lethargic, complain of pain, or just don't seem like themselves. Any of those may be the beginning signs of illness. It's extremely important that parents don't send their kids to school sick. So why is this? Well, the answer is pretty simple. Staying home when sick is essential to keeping infections out of school and prevent the spread to others. One sick child can easily lead to a whole class being sick. Although we didn't see much flu last year, we may see some flu this year. There are multiple flu symptoms to be out on the lookout for. Some of these symptoms include fever or feeling feverish and having chills, cough, shortness of breath or difficulty breathing, fatigue or tiredness, sore throat, runny or stuffy nose, muscle pain or body aches, headache, vomiting, and diarrhea. Unfortunately, both flu and COVID-19 have similar symptoms. If a child is having any of those symptoms, parents should seek guidance from a healthcare provider. Parents and children can help prevent the spread of germs and illness when they go back to school by staying home at the first sign of illness. They also should be promoting hand hygiene, encouraging children to keep their hands clean and away from their mouths, eyes, or anywhere germs can enter the body, discouraging the sharing of food and drinks, and this may help prevent respiratory and gastrointestinal illnesses, and by covering coughs and sneezes. Keeping your hands clean is one of the best ways to protect you and your family from getting sick. Washing and/or sanitizing hands can prevent the spread of many types of infections. Germs can spread from people or surfaces when you touch your eyes, nose, or mouth with unwashed hands, prepare or eat food and drinks with unwashed hands, touch a contaminated surface or objects, blow your nose, cough, or sneeze into hands, and then touch other people's hands or common objects. Because of this, it is vitally important that everyone know how to practice proper hand hygiene. To properly wash your hands, you want to wet them with clean running water, either warm or cold, and apply soap. Lather your hands by rubbing them together with the soap. Make sure you lather the backs of your hands, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. So how do you know 20 seconds has passed? Well, hum the happy birthday song from beginning to end at least twice. Then rinse your hands under clean running water. Finally, dry your hands with a clean towel or air dry them, and make sure you turn the faucet off with a clean towel and not with your clean hands. Washing your hands with soap and water is the best way to get rid of germs in most situations. If soap and water are not readily available, you can use alcohol-based sanitizer that contains at least 60% alcohol. You can tell if the sanitizer contains at least 60% alcohol by looking at the product label. Sanitizers quickly reduce the number of germs on hands in many situations. However, they do not get rid of all types of germs, and you don't want to use it if your hands are visibly dirty or greasy. It's important to properly use hand sanitizer as well. Properly use hand sanitizer by applying the product to the palm of one hand. Then rub your hands together and rub the gel over all surfaces of the hands, similar to how you would wash your hands. Do this until your hands are completely dry. It is also vital to teach kids the importance of covering their coughs and sneezes. Covering your cough or sneeze, or respiratory etiquette, is important to protect others from getting sick with a respiratory illness. When you cough into the air, you can actually send large droplets with germs as far as 3 to 6 feet in front of you, and smaller droplets can go even further. If you cough into your hands, you could transfer germs from place to place when you touch something. In order to perform proper respiratory etiquette, you want to use a tissue to cover your mouth and nose every single time you cough or sneeze. You can resort to coughing into your elbow if a tissue is not available. Again, never cough into your hands or open air. Always turn your face away from people around you when coughing or sneezing. Place your used tissue immediately in the trash can and wash your hands with soap and water, or use an alcohol-based sanitizer that contains at least 60% alcohol after you cough or sneeze. At home, surfaces should be cleaned and disinfected regularly, especially high-touch areas such as light switches, doorknobs, and appliances such as that refrigerator. Disinfection is really important because it removes any remaining germs on surfaces, which further reduces any risk of spreading infection. To disinfect areas, use an EPA or U.S. Environmental Protection Agency disinfectant for the appropriate amount of contact time. Always look at the labels for instructions on proper use. One of the most significant public health strategies to prevent illness is vaccination. Parents should ensure that children are up to date on required vaccines and also consider recommended vaccines such as influenza and COVID-19 if children are eligible. The use of vaccines have led to major improvements in child health over a relatively short period of time. Many of the infectious illnesses that you or I or even our parents had as children, such as chickenpox, polio, measles, no longer affect most children today. The immunization guidelines recommended by the American Academy of Pediatrics was developed to provide immunity to children before they're exposed to potential harmful diseases like hepatitis B, measles, mumps, polio, and more. So why is it important to keep our kids up to date? Well, imagine if a group of babies and young children fall behind on their vaccines. Those diseases will actually have an opportunity to reemerge, which can cause outbreaks and potential deaths in our communities once again. It is also important that parents ensure children receive not only the initial vaccine, but also the booster vaccines at the recommended ages. Teachers also play an important part in stopping the spread of illness in the classroom. Teachers should also stay home when they are sick and also know they have symptoms of flu so they can identify children who may be sick and so they can be sent for evaluation or even home. It is also important to support physical distancing when possible, especially to prevent the spread of respiratory illnesses like COVID-19 and flu. Teachers can also ensure that hand sanitizers and tissues are readily accessible and promote good hand hygiene and respiratory etiquette practices in the classroom. Another aspect that's important is proper ventilation. Proper ventilation in the classroom is important to reduce the number of viral particles in the air. So if your classroom is hot or feels stuffy, reach out to your facilities maintenance team to check out the problem. Also, teachers can keep classroom surfaces clean and disinfected, especially in high-touch areas and shared items such as equipment such as doorknobs, desks, tables, or if you teach young children toy bins. If you or your child come down with the flu, contact your healthcare provider to determine whether antiviral medication is necessary. You or your child should stay home and rest and rehydrate. As a general rule, children should not come back to school until at least 24 hours after their fever is gone without the use of fever-reducing medicine such as Tylenol or Motrin. However, I recommend you check your child's parent handbook, website, or call the school to review individual sick and return to school policies, as some schools may have different guidelines after the pandemic. Preventing the spread of illness both in and out the classroom may be stressful for parents, students, and teachers alike. However, if we all follow best infection prevention practices, together we can lessen the spread of illness and keep ourselves, our family, and our community healthy.